On behalf of the Advancements in Postpartum Hemorrhage Care Partnership, we warmly welcome you to our webinar. My name is Emily Peca, and I'm pleased to provide an introduction and orientation to our partnership and portfolio. The APPHC partnership was born out of a one-time catalytic investment targeting two countries chosen by USAID, Malawi and Madagascar. Both countries have large-scale bilateral programs. The opportunity was to generate and test solutions and advance effective implementation of approaches for PPH prevention and treatment. This work is in support of USAID's objective to strengthen maternity service provision within and beyond the context of COVID. Before we dive in, let's situate ourselves within the context of the two countries of focus. Madagascar is an island nation with a relatively higher and more urbanized population compared to Malawi, a landlocked nation in East Africa. Each country has different primary languages and cultures. However, if we turn to the rates of maternal mortality, we see they are fairly comparable along with the contribution of PPH to maternal death. Also of note is Malawi's much higher rate of facility delivery compared to Madagascar. In addition, we include cases and death estimates due to COVID-19, given this is an important factor that we had to navigate throughout our work. Diversity in our focus countries allows for broader relevance to other contexts. Many of us don't need convincing in terms of why it is important to address PPH, given it is responsible for 1/4 of all maternal deaths, which is what we saw reflected in Malawi and Madagascar. Given this is a persistent problem, it deserves attention in terms of prevention and treatment options. Despite the difference in country context, local stakeholders in Malawi and Madagascar pointed to similar types of issues as needing to be confronted. PPH is not a new problem, but it may benefit from new approaches to addressing it. APPHC affords us the opportunity to support USAID's R&D mission by using an implementation science approach. In simple terms, this means better use of evidence to improve decision-making around policy and program implementation. Implementation science is a practical and applied way of using research in real-world settings, in our case, Malawi and Madagascar. One key to success is the APPHC partnership composition, led by two complementary USAID-funded global research projects, Breakthrough Research and the Health Evaluation and Applied Research Development Project. Between these two exists a core team that coordinated the overall partnership effort. Within each country, we have global and mostly locally based institutions who have implemented our portfolio of activities. And below you can see a list of our key collaborators. Most notably, USAID missions, Ministries of Health, and bilateral investments, ONSE and Access. Given our goal is to inform and contribute to existing priorities, we engage this set of key collaborators from the priority development process and throughout. Another key to our success was the process. Respectful collaboration here implies a connection between evidence producers and users, and that research priorities reflect locally defined interests and needs. At the beginning, we knew we would conduct implementation science and research activities, and we knew we would be working in Malawi and Madagascar, but we had to determine our specific set of priorities and activities. We understood a number of domains that were relevant and potentially suitable to address in theory, thanks to the MCSP PPH framework. You can see the domains depicted across the top of the graphic. Below, you see our process of narrowing down to our existing portfolio of activities. And you can note on the right the box indicating that given the pandemic situation, we had to repeat some of our priority development steps in order to adapt our activities. Our stakeholder-engaged consultative process yielded more ideas than we could reasonably address. Here you see the principles used to ultimately determine our portfolio. These include embedding in local context and ongoing investments, and we also wanted to have a multi-domain focus, so instead of going deep and narrow in one domain, we wanted to contribute to learning and change across multiple interconnected domains that influence PPH. We also made sure our evidence generation was actionable and feasible, and that we leveraged the strengths of our APPHC partnership. Our portfolio in Malawi and Madagascar contribute to the areas depicted in the blue outer ring here. While we do not have time to review every activity, you'll have a chance today to learn more about how we tested provider tools and mentorship models, investigated provider mental health, and assessed maternal death surveillance and blood bank systems, and how we supported the use of data during a global pandemic. The following presentations will highlight examples of how the APPHC partnership has sparked change. In terms of policy, our process in Madagascar launched dialogue around including TXA on the essential drug list. In Malawi, the process resulted in a high demand for discussion of blood products and the re-engagement of the hospital transfusion committees. In addition, one of our studies led to the updating of the National Maternal Perinatal Death Surveillance and Response Guidelines. In terms of informing changes in practice, our larger implementation research studies, 1, demonstrated proof of concept of mentorship approaches that utilize virtual training apps, remote coaching, and simulation, and 2, resulted in the uptake of birth companion briefings and other provider tools in health facilities. And while not addressed in this webinar, our mixed methods research is informing adaptations of the community health hotline in Malawi. Research often produces new and important questions. Among many, 2 examples of this in our experience are further interest in examining provider mental health and impact on provision of respectful care, and transfusion science initiatives in Malawi. At a high level, we were able to leverage our inclusive partnership, address local priorities, and our collaborative processes accelerated learning and action across USAID investments, while enabling mutual capacity development within our partnership along the way. Another critical objective of ours is to create more sustainable and accessible knowledge-sharing systems that reach a wider set of communities and decision makers. For this reason, we've supported the development of knowledge-sharing platforms within our partner sites. Details about APPHC, our products, publications, and more can be found on our partner knowledge hubs illustrated here. I hope you enjoy the following presentations, and we look forward to continued dialogue and information exchange going forward. Thank you for your time and attention.